For those of you that are just joining us, we are going to wait a couple minutes while folks are able to trickle in. But if you could take a moment and read the slide there and take this as an opportunity to send a quick email off to somebody or give them a phone call or a text message and share a little kudos and a little positive feedback while we wait for people to come into the meeting, and then we'll get started. Eston, does it look like the entries have stabilized, or do we need to wait a little longer?
I think we're pretty set, boss.
Okay, very good. All right. Welcome everybody to another virtual town hall. I really appreciate you taking some time to join us this evening. I'm really pleased to see so many people are able to attend. I hope you were able to take a moment to share some kudos with someone, but if that wasn't enough time, of course, you can always do that anytime, and I encourage you to do so. I want to talk a little bit about our town halls. This is our 8th town hall since the beginning of August. And I hope you were able to participate in those that interested you. If there were any topics that you wanted to see that you didn't get a chance to see, then it's important for you to know that that information is available. You can check out csdecatur.net/opening2020, and there you're going to find recordings of all of the town halls, written summaries of them, district newsletters with lots of information, and just all kinds of other resources. So please take a moment if you want to catch up with any of that. This recording of this town hall will also be posted there. So these are really challenging times that we're experiencing. So I want to take a moment to talk about coping. One of the things is all adults can play a role in helping our children cope. This list that I put here is a list of behaviors you might want to watch for in your children, and they come directly from the CDC website. If you've noticed changes like these in a child you care about, you may want to consider what your role in the current environment, what role the current environment is playing in those changes in behavior, and whether or not your child may need some extra support. Some ways that you can support your children at times like this, also directly from the CDC website, so feel free to go there to review. Include talking with your child, providing factual information in an age-appropriate way, developing and sticking with routines, and being a role model for them. When you're talking with them, do your best to remain calm and reassuring, even if you're not feeling that yourself. Listen to what they have to say and try to avoid blaming others. Help them understand some concrete actions that they can take, such as washing hands or covering their coughs and sneezes. That helps kids tremendously when they can have those kind of actions. And perhaps most importantly, remember, when your needs or your child's needs are outside what you feel capable of providing, please remember there are other resources out there. These are some resources also posted on the CDC website, and you may find them helpful. And I know that's a lot of information that I just went through there, so do remember there will be a recording of the town hall posted at csdecatur.net/opening2020. So feel free to check back there if you want to dig into this more, or if you go to the CDC website, you can also find the same information there. I want to talk very briefly about risks. I get the impression in my conversation with folks over the last several months that some people only see risks as they relate to returning to in-person learning. I think the most obvious of those risks being the chance for increased virus transmission. However, there are also risks with not returning in person, and that may be less obvious. Some of those risks include the impact of the normal academic progress for our students, and quite significantly for many of our students, a very negative impact on mental health. If you haven't previously thought about risk in these terms, as we go through the information this evening, I hope you will keep in mind the broad array of potential risk inherent in any of the possible decisions that we will make, and the need to balance those risks as best as we can. Naturally, many people are asking questions about data, and I can probably summarize those questions with a single simple question. What data are you considering? So we're considering a lot of different data in our decision making. I shared some samples of those data in last week's district dispatch, so some of these may look a little bit familiar. One important metric is the count of cases in DeKalb County. As I mentioned in the district dispatch, this downward trend is very encouraging to see. We want to see this trend continue and get to a low and stable count of cases. I should also mention that while we focus on DeKalb County, since the overwhelming majority of our staff and students live in DeKalb County, we also monitor similar data for surrounding counties and for the state as a whole. Another important metric is what is called the reproduction rate. This number represents the average number of people who become infected by an infectious person. So we want to see this number consistently below 1. And as you can see in this chart, the last several weeks, it has been consistent. That's great to see. This chart represents that same information, but it is the reproduction rate for all states. And it's helpful in putting Georgia's rate into the context of other states. So as you can see here down in that bottom left corner, which I've blown up a little bit to the center of the screen for you, Georgia is relatively low compared to other states right now. So anyone who's been paying attention over the last several months knows that we have to be concerned with the capacity of our hospitals to manage demand. So this chart represents the rates of COVID-related hospitalizations per 100,000 people. The data are disaggregated by age groups, and there has been a consistent trend of the lower age groups having lower rates than the higher age groups. And as you can see, the hospitalizations peaked in mid-July and have been dropping quickly ever since. Another concern you may have heard about is that if there isn't sufficient testing, then we can't rely on the data coming out of that testing. So another metric we look at are the rates of the COVID testing per 100,000 people and whether or not the testing in Georgia is reaching recommended levels. So as you can see in this chart, Georgia is only at about 45% of the testing level needed to meet recommended levels. I'll speak a little more about the impact that has when I explain the next chart. So Georgia Tech has put together a helpful tool that presents the risk that at least one person at an event of a certain size is currently infected with COVID. What's especially helpful about their presentation is that they highlight the impact that under-testing has on the results. And I'll explain that through a couple examples. Assume you had an event of about 30 people. The blue arrow on the x-axis shows where you would start. You would follow this spot vertically until you reach the line that represents your understanding of the extent of under-testing. So for this example, I've gone up to the solid blue line, which represents a belief that the true level of infection in the community, which in this case is the state of Georgia, is 5 times what is reported by the testing that is taking place. If you then follow that point to the left, you can see that the risk that at least one person at this 30-person event is currently infected with COVID is around 35%. For another example, given an event size of around 100 people and a belief that the true level of infection in the community is 10 times what is reported by the testing that is taking place, we would use the yellow curve to estimate the risk of at least one person at this event being currently infected with COVID at about 90%. By this time, you may have noticed that there are blank spots highlighted in the what do we want to see box, that blue box on the right. That's because we haven't yet had a chance to discuss with our medical and scientific experts, what we call team science, what we should consider for those values. So if you're part of team science, you may be getting a phone call from me in the coming days, because we need to figure out what those values should be. Similar to that question is, will we be publishing those metrics? If we set a metric of what we're looking for, will we be sharing it? So based on conversations with team science, we may be able to set specific values that we're looking for in many of these metrics. I don't know yet what their advice on this is going to be, so stay tuned. But if we set metrics, we will share them. In addition to the data about the virus itself, it's really important to me to understand the perceptions of our students and parents and teachers and other staff. So every several days, we're going to be sending out short surveys to a randomly selected group of secondary students, parents, teachers, and other employees to assess their comfort level with returning to in-person learning. We'll be employing methods that ensure everyone is equally likely to receive a survey, and that those who are selected to receive the survey each week are representative of each of those populations. We've opted for this method to reduce the amount of surveys people have to complete and to not burden every stakeholder with completing a survey every several days. So in short, don't be surprised if you receive a survey one day and your next door neighbor does not. That's normal. We received several questions about our phased approach to in-person learning, so let me take just a moment to review that. So we know that, or hopefully you know that we have announced that we are going to put on a decision by September 18th. So we're looking at the data and the level of spread, as I mentioned in the previous slides. And that I want to note that the timing between the phases may be days or weeks, depending on the status of the virus in our community, as revealed by those appropriate sources. We may be looking at some programs being able to phase in a little faster than others, or we may be able to bring in a portion of a population, such as, say, kindergartners, prior to bringing in first and second grade students. In general, each phase would be completed in order prior to the next phase being implemented, but exceptions will be made on a case-by-case basis. So the first phase would focus on very small groups, and the second phase would broaden to larger populations, like entire grade levels that have been split into A and B groups. The third phase would continue that process for older students, and finally a fourth and fifth phase would continue a similar approach, but without the two separate groups. So one of the questions we saw a couple times were, how were those phases developed? Well, the phases were determined by considering the risks associated with specific groups and activities and grouping them into phases accordingly. We hope to be able to attach some data metrics to each of those phases, but we have not yet consulted with our team science to get their thoughts on that. So please stay tuned for any specific data about what will tell us when to change phases. One of the questions we saw a couple times is, why would the youngest kids return in person first? So great question. And there are many reasons for this approach. For one, younger students need more supervision and experience a larger gap in learning between virtual and in-person than their older peers do. Also, younger students are already grouped into small classes that do not change throughout the day, unlike older students who may have 7 different class periods on any given day, each with different students in them. So we got a question about virtual schooling. It doesn't work for those with special needs. So when are we going to get those most vulnerable kids back? So the short answer is as soon as possible, but we do not yet have a specific date for phase 1 priority group. Virtual schooling is working for many of our students with special needs. However, we recognize that it is important to prioritize in-person instruction for students who have multiple and significant disabilities. Students who, even with academic support, face other challenges relating to adaptive skill needs. So some questions about the hybrid schedule. How will the students be divided? Can parents request? And what would the schedule look like? So at this point, we're planning to create 2 groups across the district. We are going to try to assign students who are in the same household to be placed in the same group so that families don't have to juggle different in-person days for each child. We've begun to make these groups, and principals will be reviewing them prior to communicating with parents. This is a very complicated task, as all the schools need to work together, and we want to make sure that the 2 groups are as balanced as possible at the individual class level. So we will share the grouping as early as we can, so parents have an opportunity to let us know if we made a mistake in grouping your children into different groups, for example. Regarding the hybrid approach itself, our current thinking is a hybrid schedule that looks like this. One group would attend in person on Monday and Tuesday and engage in virtual learning the rest of the week. The other group would engage in virtual learning for the start of the week and would go in person on Thursday and Friday. We're still considering other models as well, and it's important that our teachers, to remember that our teachers can't teach 2 distinct groups of students simultaneously. So in an approach like this, teachers may choose to offset group A and B by several days, so the in-person experience on Monday and Tuesday matches the experience for the other group on Thursday and Friday, for instance. They may then use the subsequent virtual days for students to work independently on reinforcement activities and begin new learning in anticipation of the next in-person days. Our teachers are very creative and may come up with other ways to approach this as well, but in general, it's important to keep in mind that a teacher is one person, and as awesome as they cannot be in two places at once. There are other hybrid models we're still considering, such as splitting groups between morning and afternoon, or using 2-week cycles of in-person and virtual groups. So obviously there are pros and cons with every approach, and we'll be continuing our conversations with our teachers and principals and operations staff and others so we can make the best decision we can. But at this time, this is the model that we are most interested in. So some other questions. Will families still have the option for virtual only? Would you consider allowing families and as much as possible teachers to opt into in-person learning? Have you considered getting an exact number of students that want to go in person and then matching them with teachers who want to also go in person? Then you can prioritize the teachers who are older with health conditions to stay virtual and those who can get back in the classroom to go back. So in short, yes, we do plan to offer a 100% virtual option even after we return to in-person, either hybrid or full. When we get close to the point of such a transition, we will be inquiring with families and staff regarding their preferences. We will adjust staffing levels according to family needs, and we'll do our best to meet the needs of specific staff members in doing so. Those who choose to stay with a 100% virtual option after such a transition will likely need to be reassigned to new teachers, since most of our teachers will be teaching in the hybrid or full in-person environment. So when we get to the point where families need to select if they will continue 100% virtual, we will again reiterate this, as it's important that everyone understands the logistics behind these transitions. And as I said before, if you're not clear why that is that we would have to reassign kids, just remember, our teachers can only be one person at a time, and so they can only teach one group of kids at a time. So we got the question, will the superintendent and board members be meeting in person with the same social distancing that occurs in the schools and classrooms? Yes, absolutely. We would not expect students and teachers to return to classrooms if we were not willing to follow the same practices. And beyond the board, we will also be doing this with the superintendent's cabinet and administrative council and school leadership teams and building leadership teams and other such groups. If we decide that it's safe to go back to in-person learning in some form or fashion, it will be safe in many different environments, not just for students and teachers. So we were asked, when our decision is made in September, will that be final? And there's a desire there that was shared for some certainty. So we're trying to strike a balance between long-term commitments in this rapidly changing environment and short-term commitments that could result in vacillating back and forth between modes of learning. So this is why our initial decision covered the first 6 weeks of school. Given the way we already structure our school years into terms, 6 weeks seemed to be a good compromise. We'll likely stick with the 6-week framework for decisions impacting large groups like multiple grade levels, but we may be more nimble for smaller groups such as individual clubs and teams, students with specialized needs best served in person, and situations like that. We received some questions about why we changed our daily and weekly schedules when we went to virtual learning. Why does a virtual learning plan eliminate an entire day of academic instruction? Aren't we exceeding the state's recommended instructional screen time on Mondays and Thursdays in order to free up an entire day on Wednesdays? Or how exactly will teachers and students complete their curriculum, especially in AP and IB classes, with only 2.5 hours of instruction each week per course? Shouldn't we be scheduling 21 hours of instruction each week if we are going to push the limits on recommended screen time? So let's take a moment to talk about our current schedules. So several key pieces of information in those questions came from the Governor's Distance Learning and Professional Learning Working Group report that was published over the summer. On the first page of that report, there's a large red box that says, quote, "This guidance is not mandated or state required. Local school districts have the authority and flexibility to meet their individual needs and be responsive to their communities." On the Georgia Insights website, where you can find a copy of that report if you're interested, there's a large box highlighting a quote from State Superintendent Richard Woods, reiterating that, quote, "Local districts have authority to chart their course for the upcoming school year," end quote, and that the Georgia Department of Education is choosing, quote, "compassion over compliance," end quote. I appreciate that the Georgia DOE has maintained this stance on compassion over compliance, as I believe it is exactly what is needed at times like this. We have used this same philosophy in determining our rules and expectations for virtual learning. CSD is not alone in moving to 4 days of more traditional academic instruction and a 5th day for other priorities during this mass migration to online learning. There are many reasons for this. For one, we need to recognize the mental and physical health needs of our students and staff. Online learning is more emotionally taxing on most people than traditional in-person instruction is. Additionally, students work at very different paces. Having this 5th day allows those who need additional time to catch up. Another question I've been asked or seen asked is, why Wednesday instead of Friday? As you saw in the section about our hybrid approaches, we would like to have a day between groups of students to clean our buildings. So we scheduled Wellness Wednesday in an effort to plan ahead for a similar day once we're able to move to a hybrid schedule. Naturally, many people want to know about safety precautions. If students and staff return to school, what sort of precautions will be taken to ensure they're safe? So in order to make informed decisions, it's important for you all to know and understand the safety precautions we're implementing in our physical environment. Many of these solutions have already been fully implemented. We've installed over 1,000 shields or sneeze guards. Some are at open office spaces, such as front desks, as you see in these photos. Others are at student tables. In many elementary schools, students sit at shared tables, so we've purchased and installed clear dividers in those situations. We all know the importance of hand washing. Since some areas are not as easily accessible to sinks as others, we have installed some portable sinks. Don't ask me where the water comes from or where it drains to, because I don't know the answer to that. We've also purchased electrostatic fogger machines for each school and trained our custodial staff in how to use this equipment to sanitize rooms. You may have also heard us talk about our project to install cold plasma purification systems into our HVAC systems. We currently have 90% of that installed, and the final 10% will be completed this week. These devices kill viruses, mold, and bacteria within the HVAC system, so the benefits will even go beyond this specific virus. Not surprisingly, we have a lot of signs that we've placed around in various locations. Some of these go in entrances and dining areas and restrooms and classrooms and administrative offices and cafeterias and auditoriums and all kinds of different places. So when you do get the chance to come into our building, you're going to see a lot of signs such as these. Naturally, we've had questions about required masks and what about non-compliance. So all staff and students will be required to wear cloth face coverings. The cloth face coverings will not be required, however, for children younger than 2 years or if they're otherwise unable to remove the cover without help. And anyone who has trouble breathing will be required to submit documentation from their healthcare provider so we can make such an exception. Like many school districts, our mask requirements will be handled as an addendum to our dress code. So just as we would handle inappropriate dress, we will also handle the mask requirement the same way. So will there be daily temperature checks? At this time, we are not currently planning to do daily temperature checks. Staff and students will attest that they do not have a fever prior to reporting to work or to school. So how are the buildings cleaned and how frequently? The custodian staff is scheduled to increase their routine cleaning and disinfection, including areas such as frequently touched surfaces like desks, door handles, railings, and they'll be cleaning those no less than 4 times per day. Communal spaces like restrooms will be cleaned 3 or 4 times a day, and shared objects like gym equipment, art supplies, and games will be cleaned after each use. So we got several questions about how many students need to test positive before a class or a grade or a school is quarantined. Well, the current guidance from the Department of Public Health is that anyone who is within 6 feet of a confirmed case for more than 15 minutes in a classroom, school bus, extracurricular activity, meeting, etc., will need to be quarantined. I will note, though, this guidance does change frequently, so stay tuned. Will grades start at different times to minimize the number of students in the hallway at any given point? Possibly, but we don't know that yet for certain. So this is an issue specific to the middle and high schools. At the middle school, their configuration of teams within grades will likely enable staggered transitions more easily than at the high school, where there's not a similar structure and many classes have students from a variety of grade levels. So each school has a COVID response team that will be considering school-specific situations such as this and coming up with mitigation plans. Similarly, in middle schools where kids switch classes, one child might have contact with more than 100 kids. How many kids will my child have classroom contact with in a day? So in middle school, like I said, we can minimize that contact with different groups by having the teachers rotate in many cases, but some classes may need to continue online, such as some connections, and we may be able to do those within a given classroom. So when school starts in person, will the number of kids they are in contact with somehow be reduced? So this will be easier to accomplish at the elementary levels on an A/B schedule. It's much more difficult for middle and high school, which is why they are in the later phases of priority for our return. So like I said, each school has that COVID response team, and they're going to be working on those logistics specific to their school to address these kind of matters. Will we be conducting COVID testing? Will we require staff and students to be tested, and how often? So the CDC currently does not recommend that we do such testing. So we are not planning to administer COVID-19 tests. They do not recommend universal testing for several reasons. One, viral testing only provides the COVID-19 status for individuals at the time of testing. One-time or universal entry testing could miss COVID-19 cases in the early stages of infection, and it could miss exposures that happen just after testing. So implementing a universal approach in testing in schools may pose challenges, such as the lack of our infrastructure to support the routine testing and follow up in the school setting, the unknown acceptability of this testing approach among students, parents, and staff, a lack of detailed or dedicated resources to do such large-scale testing, and just some practical considerations related to testing minors and the potential disruption to the environment. However, we will continue working with our Department of Public Health, and if the recommendations change, we will adjust accordingly. Can we have classes outside? We can definitely maximize our outside space and develop a schedule for usage, of course, weather permitting. So this is another great example that can be considered by each school's COVID response team. So we got some questions about COVID-19 exposure and how will notifications happen. So what is our policy with staff or students who have been in contact with a positive case of COVID? Will they be required to report it to the district? Will they be required to stay home? So for students, if your student has been in close contact with an individual with a confirmed case of COVID-19, we're going to ask that you keep your child at home, regardless of whether they have symptoms, and begin to self-quarantine for 14 days. We strongly suggest that they go get tested by their primary care physician or approved testing site, and the testing may be available at your doctor's office or an urgent care center, a pharmacy, or other healthcare clinic. And then we ask you to immediately inform your principal and or someone else who they may have designated, such as a school nurse. Staff will have to stay home regardless of whether they have any coronavirus symptoms and begin to self-quarantine for 14 days. We strongly suggest that they go get tested as well, and we ask them to immediately inform their supervisor and our staff support department. So how will parents be notified if a student is exposed to COVID-19? So parents of students who are identified as close contact to a known case will be called by the principal, the school nurse, or another designated person. A district letter will also be sent home to those parents so that they know if they were in a impacted class. We also had some questions about extracurricular activities, such as how will the after-school and extracurricular activities be addressed? Will the decision around athletics take into consideration the numbers and groups, team sizes, numbers required on the field, in addition to inside or outside for return? Will decisions about extracurricular activities consider the ability or willingness to wear a mask while practicing and competing? So we will soon be implementing a process where staff members can submit a proposal for in-person activities such as this. These proposals will be required to address many of these same aspects and will be evaluated by the district's COVID response team, and we will make an individual decision on those proposals based on the proposal as it comes to us, as well as any feedback we may give of how to make it a better and stronger proposal so we can start to get kids back into some of these activities. We got several questions about finances, such as, does the district have an estimate of how much lower our FTE, that is the count of students, will be on October 1st compared to October 1st, October 1st this year compared to last year? and what mitigation efforts are being put in place to address the funding gap between budget and the likely shortfall in revenue from parents choosing to homeschool, choosing private school, or choosing different options. So our count of students today is nearly identical to our count of students last year in October. However, we were projecting about 182 more students when we created our budget last winter for this fiscal year. So that will equate to a loss in state revenue of about $500,000 beyond what we were projecting. Many of the students we anticipated seeing but who have not enrolled are students who would be in kindergarten this year. We have noticed that trend in many school districts that parents who could enroll their child in kindergarten are often choosing not to. We are fortunate that so far our counts are looking to remain pretty steady. Most school districts are losing significant numbers of students compared to last year. And despite the conventional wisdom being shared in the community that we have not seen a significant change from past years regarding students withdrawing to attend private schools or to homeschool. Just to clarify, we have not seen a change from past what has happened in past years. Some people have been curious how much all of this has cost. So here's a breakdown of the cost of those shields, the ionizers, the signs, and large doses of hand sanitizer that we have purchased. So about $380,000. Much of this is able to be covered by some of the CARES Act funding. And one of my favorite questions, how do I sign up to work as a sub? I want to help in-person learning succeed. So if anyone is interested in becoming a certified or non-certified substitute teacher with our district, please go to our CSD website at csdecatur.net and click on that employment icon right in the middle of the screen, fill out an application, and we'd love to talk to you. So those are the questions, summary of what we received in advance. So thank you to everybody who submitted those questions. We really appreciate it. It's great to know what things you want to know more about. So I appreciate that very much. Maggie, did any questions come in during the presentation that we can address?
Yeah, a couple came in that we haven't addressed yet. And one question I think that's really probably pertinent to many of our employees is they're wanting to know if any decisions have been made regarding how we as a district are going to compensate our staff for missing those for working 5 extra days during the break.
It's a great question. Thank you. So we're looking at several options for how we could compensate staff for those 5 extra days. We won't forget about it. Some of the things that we'll be talking about with Teacher Advisory Council and Admin Council and whatnot are, is there a way that we can incorporate some half days over time to make up those? Are we able to build in some off days into second semester? But please know that before any final decisions are made, we'll gather input from our teachers and discuss those options with the school board in terms of moving forward. The one option could be that we pay teachers for the 5 days, although as you can see, we're having some significant financial issues. So it may be better to provide those as days off rather than as paid days. But if that's the most popular option and we're able to do it, we will consider that as well. Any others, Maggie?
Yeah, another one that's come in, I'm guessing this is from a parent because they're asking if we're going to gather feedback regarding the virtual schedules that we've been running since the start of school. And if that feedback suggests we make any changes to our virtual learning schedules, will we do that?
That's a great question. Thank you. So yes, especially if it looks like we're going to continue in virtual learning status much longer, that feedback becomes even more important. So yes, we will be gathering feedback from the parent perspective, the student's perspective, and the staff perspective about how this has gone, what's worked well, what hasn't worked well. And a lot of you already provide feedback to us, and we appreciate that, and it does help us improve what we're doing already. Any others, Maggie?
One more that I think is pertinent about transportation. So is transportation going to be provided when we start bringing students back to the building?
Yeah, that's a great question. And that is a very big question, and actually one of the big drivers when we're looking at our hybrid schedules in terms of what can we actually facilitate and what can't we facilitate. And so, yes, transportation will be provided when we go in person, just like it always is provided. And so we will let you know details depending on the hybrid solution that we present. Was that the final question?
That was it. Yeah, I think that covers it.
Thank you. All right. Well, that wraps us up for this evening. I'll leave us with this slide that we started with, and I do encourage you. Our staff and our students are working so hard. I know our parents are working hard. As many of you saw in the dispatch, I'm a parent myself. I know how hard this is. And so if you have it in you to take a moment and share some positive feedback with someone, I highly encourage you to do that. Everybody could hear a little positive feedback at a time like this. So thank you so much for participating in our town hall and submitting all those questions. We will plan to do another one of these town halls with me in a couple of weeks as we get closer to that September 18th date, so we can continue answering your questions. And so please stay tuned. If you're not signed up for our newsletters, please get signed up. You can find that information on our website. We send out a lot of information, and I know sometimes it can be an overload, but hang in there. I'm just really proud of all of our staff and our students and parents and all of the support that they're doing. So thank you all very much. It's an honor to work in the City Schools of Decatur, and thank you for your support of our students and staff in this difficult time. Have a great night.